Okay. So I'm Dr. Valerie Flores, and I have with me my Joy Wellness partners and friends, Carol Bender and Dr. Masuda. Today, we wanted to chat with you about understanding and, of course, supporting your reproductive health, really focusing on holistic fertility care. Just a brief little intro about me. I know I've met a lot of you already. I'm a reproductive endocrinologist and infertility specialist. I'm originally from Southern California, but completed most of my training on the East Coast. And it's very nice to be back in sunny California. And then I will let Carol and Dr. Masuda introduce themselves as well.
Sure. So I'm Carol Bender. I founded Joy Wellness Partners 9 years ago to provide a total health integrative approach for well-being for the long term. And I did my nurse practitioner degree also over in the East Coast at UPenn in Philly. And Dr. Mairead Masuda joined our team about 5 years ago, and she's a naturopath from Bastyr University, but she can say hi.
Yeah, Dr. Mairead Masuda, like Carol said, I did my training at Bastyr University, one of the naturopathic medical schools here in California. So I've been lucky I've been able to stay here. And just since then, been finding my focus, working with different practitioners and we do a lot of hormonal health here, and I think that just really lends into the fertility space as well. So that's always been just a joy of mine to treat and help with.
Perfect. And then I almost forgot to add, so I had the pleasure also of meeting them in person and having a lunch and learn. And I think everybody knows deep down what a nerd I am and learning and getting more about science. And I just have to say, it was such a wonderful conversation just because I really think one, learning from it from how I've been trained and then how you both have been trained, and then using that to really work towards helping patients is key. So it's really exciting to be back with you guys, and I'm really looking forward to our conversation. And so with that, I'll go ahead and get started. Um, Okay, so it all does start with the egg and the sperm. And so I really just wanted to briefly highlight the fact that in order to have a successful pregnancy, we need to have an egg that is able to be ovulated and released. We need to have a functioning reproductive tract, meaning knowing that the fallopian tube is normal, knowing that the uterus is normal, and then ultimately we need sperm to be able to reach the egg in the fallopian tube, fertilize the egg, and ultimately have implantation. And so what I wanted to really focus on today was really going through that fertility workup and going through if there's something wrong on any of those levels, how can we work to correct that? And of course, focusing on whole body care and what Joy Wellness can offer our patients too. So how do we define infertility? We define infertility as a lack of pregnancy after 1 year of trying. Primary infertility means that there have been no prior pregnancies. Secondary infertility refers to patients may have been pregnant in the past or had children in the past, but are now finding it a little more difficult to conceive. But it is also important to recognize that infertility is very common, even though it can feel very isolating. It really does affect 1 in 6 individuals. And so you are not alone. And the goal of this webinar is really to help inform you, provide you with necessary information, and also work on optimizing your likelihood of conceiving. So when we talk about fertility testing, when we talk about the initial workup, there are a couple of things that we're looking at. One is looking at the number of eggs a given woman has, looking at the uterus and the fallopian tubes, and for those with a male partner, looking at sperm, and really looking at how the sperm look, how many sperm, and do they overall look normal. So the ovarian testing that we recommend typically are anti-Mullerian hormone. They're all blood tests. Anti-Mullerian hormone, follicle stimulating hormone, and estradiol. Anti-Mullerian hormone is the hormone that's made by the eggs in the ovaries. So it's a good indirect indicator of how many eggs you have. Not literally, but more for your age, good number or low number. Follicle stimulating hormone comes from the brain, tells the ovary it's time to make an egg, and then the estrogen comes from the growing egg. It's the one time low values are normal. That's a good indicator that the brain and the ovary are communicating well with each other to say that it's time to grow an egg each month. And then we also recommend an ultrasound. We're looking at a couple of things. On the lower right, I have a picture of an ovary, but we're also looking at the uterus, making sure that there's nothing in the uterus that would make it hard for an embryo to implant. And then, of course, counting what we call the antral follicle count. So that's looking at the cohort of eggs that you have in a given month, not how many you have left. What we're counting is really what's available for the given month, and it should be similar from month to month. And then in terms of looking at the uterus, the first test is what we call a two-dimensional ultrasound. So here we can see the endometrium where implantation will happen. Sometimes there can be some features of potentially something in the uterine cavity, like an overgrowth, like a polyp or a fibroid. And so then we can do a saline ultrasound where we put some water in the uterus. It serves as a good contrast to really look at if there's something in the uterus that would make it harder for an embryo to implant. And of course, if we found that, we would talk about that and talk about how we'd manage that too. The last part of the female evaluation is really looking at the fallopian tubes because that's ultimately where the egg and the sperm are going to meet. And so that we call a hysterosalpingogram. So it's an X-ray based test where there's a water-based dye that gets placed in the uterus. And so here you can see this is actually a little catheter that's putting the dye into the uterus. And then in a radiology suite, X-rays are taken and you see the dye actually traveling through the fallopian tubes. So when should patients seek an evaluation? It's a bit of a trick question. Technically, you can come see us whenever you'd like. We offer both information just in terms of family planning, and then of course also if there's been difficulty getting pregnant. But our general guidelines are in individuals who are less than 35, after a year of unprotected intercourse, we do recommend seeing a fertility specialist. And that's because most couples who don't have infertility, around 85% would be pregnant after a year of trying. In those over the age of 35, we recommend the evaluation after 6 months of trying. And in those over 40, we recommend a more immediate evaluation. And you can see the graph on the right. This is not to scare you. This is just more to give you information, kind of explain why we recommend the workups when we do. We do see, unfortunately, in the purple, our fertility unfortunately does decline over the years, and it declines more rapidly once we get to be in our mid 30s. And then what also changes is the quality of our eggs changes. And so we see in the green a higher risk of miscarriage over the years because the eggs have trouble dividing over time. And so we do see that there's a higher likelihood of eggs that can be chromosomally abnormal. So that's why we recommend the workups when we do. But of course, we're happy to see patients at any point along their journey. There are also some situations where we recommend, even if you're less than 35, that you come in for a sooner evaluation. And so patients with a history of irregular cycles, because usually that means ovulation isn't happening. And so we need to investigate that further. One of the more common causes of that would be polycystic ovarian syndrome. In cases where we have a known history of either fallopian tubes being removed or damaged, patients with endometriosis, we know there's a 50% likelihood of having infertility as well. Patients who have a difficulty with intercourse, and then for our male patients, if there's any history of testicular cancer, testicular injury, or varicoceles in the testes. And then I did want to talk a little bit about the different treatment options that we have. One of the first line treatments that we can offer patients is something called ovulation stimulation with or without intrauterine insemination. And so this typically involves oral medications that we're giving patients to help get them to grow, if they're not already growing an egg each month, to get an egg to grow each month. And those who are actually ovulating but not conceiving, this medication also helps to get more than one egg to grow in a given cycle to further increase the likelihood of pregnancy. We usually also recommend a medication that triggers the ovulation, really to help ensure that ovulation happens. And then we can also add on an intrauterine insemination. So this is a process by which we obtain a sperm sample, we wash it, concentrate the sperm, and then it's placed through a tiny catheter directly into the uterus. So it helps bring the sperm closer to the egg. This is recommended for patients who have what we call unexplained infertility, patients with irregular menstrual cycles, or if there's a slightly lower sperm count or motility. This will also, the IUI helps overcome some mild male factor infertility. And then the requirements would be that we know the uterus is normal, the tubes are open, and then making sure we have around 9 million sperm in a given IUI sample. I did want to talk a little bit about what the success rates are. It does vary. Typically, we say after 4 rounds of oral medication, the likelihood of getting pregnant is around 20%. In couples without a history of infertility, the likelihood of getting pregnant each month is around 20% per month. So the goal is really getting patients to be at that level. Injectable medications, we use them a little less often. They do have a higher likelihood of success, but they also have a higher risk of twins or multiples. And so this is something, depending on your particular history, that we talk about a little bit further if that's something we want to transition to. And then unfortunately, rates are lower for couples who are in their 40s. And that again speaks to the decreased egg quality and quantity that happens. Doesn't mean that we don't have options, however. The other treatment option that I wanted to talk about is in vitro fertilization, where now we're giving injectable hormones to get lots of eggs to grow ideally at once. But this time we're going to retrieve those eggs before ovulation. It is a vaginal procedure, so no incisions on the abdomen. Patients get anesthesia. The reason why is because there's a little needle that we pass through the vagina into the ovary to suction out the eggs. And so that's not something that we feel like patients need to be awake for. But this is another treatment option that we offer individuals. And this is just a little bit of a diagram of how that process works, because I know it can seem a little daunting sometimes. So the ovarian stimulation, it does involve injections. They're subcutaneous. They're small needles, thankfully. After a certain amount of time on the injections, we then complete the egg retrieval. That's the vaginal procedure here. And then from there, we would inseminate these eggs with sperm. Once they're fertilized, we watch them develop into embryos and then ultimately plan an embryo transfer and hopefully the success of having a baby, being pregnant and having a baby. The embryo transfer process itself is also an interesting one and a fun one that we like to do as fertility docs, of course. There's no anesthesia. What's nice is that patients can actually be awake for this. And so you'll see, we'll have our screen where you'll see your embryo being loaded into a catheter, and then ultimately you'll see us placing that embryo directly into the uterus. So it's pretty cool. And of course, something that we talk about more if this is the treatment option that we ultimately decide. We also now have the ability to chromosomally test embryos to determine not only if it's a boy or a girl, but also look at if there's an increased likelihood of having a chromosomally abnormal embryo. This is particularly helpful for individuals over the age of 37, where we see an increased risk of chromosomally abnormal eggs, which would then translate to a potentially abnormal embryo. We also do have the ability to test for single gene disorders. However, only if we know that a given couple has a risk factor or has a known genetic disorder, and then we can test for that as well. And then the last thing I wanted to touch on was just fertility preservation. So I know we talked a lot about when to seek the fertility workup and those who are actively trying to conceive. But even for those who may not be interested in conceiving now, but want to make sure that they have that as an option in the future, we also do offer fertility preservation. And this can either be egg freezing or embryo freezing. It's no longer experimental. It starts off as an IVF process, except we end with retrieving the eggs and freezing the eggs. And we can do this for a variety of reasons, both social and medical. We freeze these eggs through a process known as vitrification, and they are essentially frozen in time. So you can decide to use them years later, or maybe you ultimately have a family on your own, but we do have these eggs available for you, your eggs available for you for the future. And with that, I actually we'll definitely have time for questions at the end, but I did want to give a chance for Joy Wellness to chat because, of course, another big part of this is, again, whole body care and really working on optimizing not just the treatments that we can provide you, but optimizing your body in preparation for fertility treatment as well.
Okay, great. Can you see the screen, Dr. Flores?
Yes.
That's awesome. Thank you so much. I'm grateful for the resource that we have right in our backyard for these patients and for all the way that science has advanced to enable these opportunities to be possible for women and men and their family building. I know that was a big relief for me back about 10 years ago when I was looking into my own fertility concerns. And so I was super grateful to know all these options existed in case I needed them. Dr. Masuda and I are both mothers, and so we personally deeply care about women and men and their desires to have their family and build their family. So it's very exciting when we get to collaborate together. As we know, we are, not hormones, ovaries. That's not the only thing that fertility is about, but our whole bodies, our stress levels, our sleep, our spirit, our environment influences our fertility journey as well. And that's something that for sure I learned myself too. So let's see here. First of all, how does stress influence or impact fertility? Well, I like this little diagram. It basically was a simple way to show that cortisol, the main stress hormone in our bodies that's released usually by the adrenal glands, can really suppress the hormonal impact on the ovaries. And so women will find that they're having issues not only with their periods and irregularities, but that they can have worsening anxieties and hormonal fluctuations that will then translate also to fertility challenges as well. The body really does want to be in a state of being safe, being calm, being nourished, and feeling ready to bring a new baby into the world. And so stress is kind of the antithesis. Like if you're picturing yourself back in caveman days running from a tiger in the jungle, that's not the optimal time to bring a baby into the world. And that's how our bodies are still kind of programmed and wired. So chronic stress and elevated cortisol will really be a challenge that we want to be aware about and be able to help people to bring down those stress levels as we know how to evaluate it. Here we go. So in addition to stress, we also have things that are part of our daily lives that are big factors in our fertility optimization. So like we mentioned, not only does stress influence hormonally, but it'll also influence our desire to have sex on the right times of the month. And it can also impact just our, the implantation of the ovary of the egg. And so we really want to work with patients on their sleep to help them with improving their sleep quality, because that can bring stress down and help everybody to be in the right state of mind and body for receiving the fertility optimization. Hormones are something that can be both influenced by lack of sleep and also can influence and improve sleep quality. So we work a lot with hormones to improve sleep at the clinic and also work with people on their sleep habits. And it can be such a life-changing impact when you start to get good quality sleep. We also look with patients on their blood sugars, their inflammation, and their nutrient levels, because vitamins, amino acids, they can all have an impact. Even back to the hormones, the thyroid hormone is a very important one that we test for. Like Dr. Flores mentioned, the estrogen, the FSH, but also testosterone can help improve the egg quality. So we like to look with our comprehensive blood work to help patients get a holistic health optimization approach going into this journey. And then mental health, like we know that it's under addressed, the anxiety, the depression, concerns with mental health can really impact fertility. Again, that whole concept of feeling safe is really, really important as we approach fertility. So we have a few tools in the integrative world, some within Joy Wellness Partners and some outside our clinic that we like to talk to patients about and give them the opportunity to be aware of to just optimize their chances of success. We know it's a big investment to undergo a fertility journey in time and in changes to your body and in finances. So we like to help patients to have the most optimal success from the least amount of rounds possible of their fertility journey. So things like we discussed, not only will we work with patients on their nutrition, on testing their vitamin levels, testing their hormones in a more comprehensive way, but we'll also work with toxin testing, because environmental factors, plastics and heavy metals and pesticides, like growing up around farm fields, different influences can really influence the egg quality. So we like to help patients to get those eggs to be as healthy as possible, because if you're healthy, then you have the best chance of your egg quality and your sperm, even for the men, the sperm to be as healthy as possible. And that process that Dr. Masuda will talk a little bit more about, but it can take several months to year or so to really get all of those toxins released and get your body into a healthy state. So it's really a cool thing to work with us even before you're ready to start a fertility journey and just to be at that optimal health state. Acupuncture is a really common practice for fertility, and the whole Chinese medicine world is not something that's integrated directly in Joy Wellness Partners, but we have amazing practitioners that we refer to. But the concept of bringing more blood flow to the reproductive organs is something that Chinese medicine has decades and decades of years of experience and success with helping to improve the blood flow and also reducing the stress levels and making a person more ready for ovulation, health, and fertility. We provide a lot of peptide and IV infusions like NAD, iron, nutrients to replete them in a quick way. So it doesn't always have to take months and months to get like your vitamin D level or your iron level up to optimal and get away from concerns like anemia or just even cellular health, like the NAD helping the mitochondria. We recommend understanding your cycle and understanding with things like wearables, like the Ava bracelet is an example where you can just understand a little bit more about your monthly cycle and when you're fertile. And those kind of approaches are great with technology these days. There's quite a few options. Some individuals are interested in our regenerative medicine, like IV infusions of exosomes have been shown to really help sperm counts improve dramatically. And so that's something that patients will seek out from our clinic. At times, they also ask about the PRP injections into the ovaries to help the ovaries and the egg quantity and quality. Mental health care and mental health optimization. We see our patient here using a gratitude journal to help out with anxiety and with optimization of her feeling of gratitude and safety and putting her in a good state. That's something that mindfulness practices, meditation, even counseling can be things that we refer patients to as protocols for their stress reduction. And then finally, stellate ganglion blocks is just something I thought I'd mention because it's a little bit of a cheat code to resetting the fight or flight response. If somebody has trauma, even sexual trauma that can be impairing their experience with fertility goals, they can go for a stellate ganglion block, and that can really help to take them out very quickly out of the fight or flight mode into more of a rest and a digest and a be at peace and a have fertility, have good sex, have good relationships, good sleep mode. So those are some cool strategies that we like to talk about with our patients, and Dr. Masuda will go into more detail here.
Yeah, so just going a little bit more in depth into some of the things that Carol spoke about. Obviously nutrition is a big one. I was lucky to receive a lot of nutrition training at school, and it's something that I'll usually work with people first, like least invasive thing possible. Let's start with nutrition, and diet is one of the probably the hardest things to change. I'm not like, it's way easier for me to say, hey, just take the supplement, but it's hugely important because, like I say here, I look at the body as a bank account of nutrients, and pregnancy, like a whole fertility journey and pregnancy, is going to be like a period of massive withdrawals. So we really want to get ourselves into a state of, banking all those nutrients so that we know that we're at a good level, that we're not going to become depleted very quickly. Just for ourselves, our experience through pregnancy, because I don't know if I've been anemic through pregnancy before, but it's not fun. And in terms of how long we want to do this for, at least 3 months to help with ovulation and egg quality for women, and then at least 70 days for the men in terms of sperm quality. So, and like I said, I like to just tell people, like, look, if you're even considering it, just come in, we'll have a look at things and see where you're at. Where can we support? Because overall, it's only going to benefit you. Even if you don't end up, I changed my mind, I don't want to have kids. It's still going to benefit you and how, your health. So what I like to look at in terms of diet, so I guess I call it kind of Mediterranean style, but with some tweaks. I like that basis of Mediterranean style. I've tweaked it a little bit in terms of a little bit more emphasis on protein, And this can be from, I know it's very much animal based right now. It's very, very popular, but animal or plant based. I think a combination of both, if you can, if you enjoy that, I think is great. I mean, I'm half Japanese. You're not going to take my tofu away from me, but I love animal products too. And I think, having the variety is great. But really, about 1.2 to 1.5 grams per kilogram is kind of what we're aiming for, which is a little bit more than what I think the Mediterranean diet typically calls for. So the reason we want to do that is because we want to have those hormonal building blocks, and also for helping with balancing blood sugar, which is going to be something I speak about a lot. And I'm also monitoring my blood sugar right now too, so I will speak about it a lot. But yeah, so for that reason. And then, also, again, I think a lot of these things will come in just naturally with a Mediterranean style diet, but making sure we are prioritizing certain micronutrients. One, for fertility, but also again, for when you do ultimately become pregnant and the needs of the baby and the health of the baby. So again, iron, I spoke about being anemic. They just steal that iron from you. So making sure that we have optimal levels there, again, from both animal sources, but also, tofu, spinach, black beans, chicken, they're all great sources. If we are going to be doing plant-based sources, making sure we have vitamin C with that to, aid in absorption. The other thing would be choline. And this is really, again, for, it can also potentially increase antral follicles, but also for their, again, down the line when you are pregnant, for their brain development. So getting those eggs in, liver, if you're into it. A couple other ones like B12, folate. We know like how important methylfolate is. The folate is for that neural tube development. DHA, making sure that we are getting those fatty fish in. And if not, again, I'm going to speak a little bit later about having a really high quality fish oil on board. And then, some of the common nutrients that we do see that are kind of low in a lot of people are vitamin A, D, zinc, some iodine. I like seaweed for my iodine. I think if you are eating kind of a rainbow of fruits and veggies, you're going to be getting a lot of these things in. And then, so the last one that would be a little bit different, again, tweaking the Mediterranean diet just a little bit, getting most of our carbohydrates in from more of the less starchy vegetables. So artichokes and asparagus and all the cruciferous vegetables, all the leafy greens, especially for our population, which I think a lot of us are a little bit more prone to insulin resistance than we previously thought. Getting our carbohydrates from this source is going to give us so many more nutrients without as much of the blood sugar spikes. So again, this is not just a one size fits all, but if we are kind of aiming for this style of diet, I think it's going to benefit the most people. So, okay. And so again, I know I said I'm going to harp on about blood sugar a little bit. That's because it's really important. And this is really, from some of the recent research that, I've been looking at, excuse me. I mean, there is an impact on egg quality. So, I think it was a study in Japan that noticed that there was a direct correlation between higher sugar consumption in the months leading up to an IVF cycle and poorer egg quality. So again, whether we are able to get pregnant naturally or if we're going through IVF, we want to give this the best shot possible. Obviously, it can also disrupt our hormonal balance. Insulin resistance is going to mess with that. It's going to mess with ovulation, and actually affects our uterine health too, and the health of our uterine lining. So whether an embryo is going to implant as well as it can, and then same with male fertility. The same thing that's going to happen with egg quality is going to happen with the sperm. When we have higher blood sugar levels, it's actually going to disrupt the balance. And I'm going to go into a little bit of science class detail in a little bit, but it's going to disrupt the balance of the reactive oxygen species that we're producing, which we produce all the time when we're making energy, and that's fine. But when there's too much of that and not enough to clear that, that's when we're going to see the mitochondrial damage, which is going to lead to DNA damage in our eggs and of our sperm too. So that's going to hinder our fertility. So yeah, I mean, again, I think keeping our blood sugar in check is going to be the best for most people, but especially important for people with pre-existing conditions like diabetes or polycystic ovarian syndrome. Okay, so I do want to speak a little bit. Now I put these together. I put exercise and emotional well-being together because I feel like, I mean, I talk to people all the time, and when I say, hey, what are your stress relieving practices? Exercise is one of the ones they talk about. So just for fertility, I mean, just life in general and our longevity and our health, it's you know, some kind of mix of strength training, cardiovascular exercise, and some kind of mobility work, right? I always say if I had unlimited funds, I'm going to be able to have like a Pilates reformer membership. I'm going to be able to go to a strength training gym and some kind of maybe yoga or mobility work. So some kind of a combination of that. And again, this should be adapted to individual needs. So for example, using that example again, if you have been diagnosed with PCOS, especially if it is one that is being triggered more by adrenal dysfunction, yeah, we're going to want to focus a little bit more on lower intensity exercise as like the main form of your exercise. Now, that's not to say that, you know, doing a HIIT workout every now and again is going to ruin everything. I mean, I think they're fun. You come out of them, you have those endorphins going, you feel good. And I think that's important. And I think this is how I tie it into the emotional well-being. So really, and again, because I do see this pretty often, I'll have someone come to the office and they're like, I'm doing everything. I'm exercising, but not too much. I am cold plunging and I'm doing the sauna and I'm taking adaptogens and I'm meditating, but they're telling me this and they just seem stressed out while they're telling me. And they're technically doing all the right things. I mean, is that going to be still beneficial to you when you were still stressed out about doing it, or it seems like a chore? So one of the things that I actually tell people a lot is like, okay, look, you know, go do a dance class instead of a spin class if that's what you love. Go garden or take a walk, take a day off from working out, take a day off from meditating because you feel like you have to. Do things that bring you joy. I don't know if I can bring Marie Kondo into this a little bit. Like, does it bring you joy? If not, maybe get rid of it. Because so many times, like with work, with just life in general, there's some things that are not always going to make us super happy, but we need to do them. So really balancing that with things that make you really happy, like garden. Instead of having to sit, okay, I'm going to sit, I'm going to meditate, go garden, go for a walk, go do a dance class, whatever makes you happy. So I think that's especially important going through a fertility journey, because it can be very complex and it can be quite stressful. And there's a lot going on. There's lots of appointments, lots of things that you're thinking about, and lots of things that are out of your control. So I think that's really, really important. That's why I tied those two together. So yeah. Okay. So some of the, I want to get into a little bit more detail about some of the supplements and additional therapies. So goes without saying, if you're even considering fertility or starting your fertility journey, getting on a good prenatal. I don't know if I'm allowed to speak about any brands. Yeah, okay.
Sorry, I was muted, so it took me a minute. Yeah, you're allowed.
Okay. I mean, I do love the prenatal by Needed. They do have the one that's just like the essentials. So while you're, again, just kind of considering getting pregnant, considering having a family, it's just like a really stacked multivitamin, geared towards fertility. And then once you are pregnant, they've got I call it like a heavy hitter, because it's got really like the therapeutic doses of everything that you need. For example, like an optimal vitamin D3 dose. Choline, which is so important. They've got a really like an optimal level of choline in there. And then same with like methylfolate. They've got what you need, but not too much. I find that sometimes I see some other ones that are just like sky high, and it's like, this might not be necessary. And not everyone responds super well to high doses of methylfolate. So yeah, so goes without saying, a good prenatal. And then, yeah, like I mentioned before, a high quality fish oil. Unless you are eating the smash fish multiple times a week, so that's like sardines, mackerel, anchovies, salmon, and herring, which I feel like aren't super common for everyone to be eating really often, then I think a really good high quality fish oil is important. And, finding one that is third-party tested, because heavy metals is of course a concern. We don't want to be just like, yeah, take this, and now we're upping our heavy metals and we're creating another barrier. So yeah, that is important. And then I say potentially iron or extra vitamin D if needed, because again, this is where we come in, we test, we look, okay, what does your bank account look like of your nutrients? Do you need iron? Maybe you don't. We don't want to just throw iron at you if you don't need it. But definitely if you do, we want to make sure we're repleting that. And more often than not, we do need a little bit more iron. And then, like I said, the main needed prenatal does have about 4,000 IU of D3 in it, which is great. For most people, that's sufficient. But if you're starting from a position of it being lower, we might need to add a little bit on top of it for a little while. And then I put antioxidants in all caps. So this is where I'm going to speak a little bit more about, I guess, a little bit more detail to mitochondria, bring you back to, I don't know if it was high school or college biology class, but we talk about mitochondria as the powerhouse of the cell, right? That's where we're making all the energy. And so all the aspects of fertility are it's such an energy rich process, from creating follicles to ovulation to, the conception, implantation. It just requires so much energy. And if we are low for whatever reason, so for example, if we have any mitochondrial damage, which can come from many things, right? From environmental toxins, which is why we look at that, from stress, from high blood sugar, all those things are, like I said before, are going to create that imbalance between the reactive oxygen species, the bad guys, which we want a little bit, but not too much. And, it creates too much. We're not able to clear them out as quickly. So, and that's, again, what leads to the damage with the eggs and the sperm, the quality. So antioxidants are those guys that come in and they just protect our cells. They help to keep that balance. They keep those reactive oxygen species in check. So again, there's so many different antioxidants. I put a few of them here. Something like CoQ10, which is fat soluble. Really, again, I don't know if you remember, but the electron transport chain, it's in there. It's really important for creating energy. Something like ALA, which is both fat and water soluble. So it's going to be able to get to the different parts of the cell. And it also actually helps us produce more vitamin C and vitamin E, which again are more antioxidants. So there's a list here. I love NAC, N-acetylcysteine. It's an amino acid, precursor to glutathione, which is our master antioxidant. Resveratrol, L-carnitine. There's lots to choose from. Not saying that you need to be on all of these, but there's many that you can choose from. Pick one or two, maybe switch them out every now and again. But again, really important. And I'm going to speak a little bit more about NAD because it is something that, again, is going to support our mitochondria, and that's going to be in the next slide. So I'll just leave that for just a minute. And then, like I said, additional therapies. So acupuncture, again, I don't even begin to pretend that I can speak to acupuncture or Eastern medicine. It's been around for thousands of years. There's a reason for that. I actually wanted to do the dual degree at Bastyr, but then I ended up having 2 kids while I was in med school, so I thought that was enough. But again, like Carol mentioned, for lowering stress and improving emotional well-being, improving blood flow, as well as helping with hormonal balance. So really great. We like to refer to some people that we know, can be very helpful. And in addition, I mentioned pelvic visceral manipulation. So again, this is going to help with blood flow to the area, to the pelvic organs, but also, a lot of people will have adhesions for many different reasons, and helping to make sure that everything is kind of able to lubricate it, able to move the way it's supposed to, just helps with the flow of everything. So I think those are nice modalities to add in. And like I said, this is for most, but everyone's going to have their own unique needs. And yeah, and so I just want to speak about NAD a little bit more, just because that is something that we provide here. Not to get too scientific, but nicotinamide adenine dinucleotide, that's what NAD is. We need it for every single one of our cells. Every cellular process, it's constantly needed to be renewed and recycled. And it is something that we are able to recycle it less and less as we get older. So again, part of what this does is it's really important for mitochondria. So this is, where it comes in, the whole egg quality, the whole sperm quality, and just supporting the overall health of our reproductive cells. And especially, I think, this has kind of been a buzzword or a buzz a buzz thing, you know, to do, to ask about NAD. Because, you know, I think a lot, I don't know if you've seen an increase in people who are a little bit older being like, hey, I want to start my fertility journey. What can I do to really get things going as quick as I can or as successful as I can? So, you know, NAD can really help with that age-related fertility decline. And so, you know, can we help improve our egg quality? Can we help improve embryo growth and just restore fertility? And same, you know, the same goes for men with their sperm quality. So it's a nice modality. I think, you know, it's not very easily absorbed when we take NAD plus by itself, when we take it orally. So you can take the building blocks like NMN or NR, or you can do something like an IV, which is going to get, you know, obviously directly where it needs to go. But it is nice. Again, it's just an additional modality that we have to, can we support our mitochondria? Can we support creating the best environment possible for whether, again, we're getting pregnant naturally or going through IVF or IUI or anything like that. Yeah.
Cool. So we'll give it back to Dr. Flores. We just have our little info here if you want to screenshot that, and then we'll give the screen back to Dr. Flores here.
Yeah, no, thank you. I was just going to share a few more slides here, mainly getting into our questions and some QR codes. Let me just make sure. There we go. Okay. So one, I just wanted to say thank you both so much. That was amazing. And I want to highlight what I particularly love about you guys, in addition to being amazing, is that you're so evidence-based and so scientific, which I think is huge because there is a lot of information out there and we can get inundated with that. But what I really love, and even from your guys' website too, is just how evidence-based you are. I know you guys even have a section where you have some of the papers for the support for the different treatment modalities that you offer. And I think that's huge because there's a lot out there. Not all of it is safe, but what you guys do is really focused on evidence-based care, which I think is huge. And I love the science, the electron transport chain. I still remember that one, so I love that. And then a couple other things before we break it into questions. So for those who are participating live, I know we'll have this on YouTube. So just for the individuals who are participating live, this is a QR code for a consult with me. I'd love to see you both, or you see you all. And then I just wanted to include a QR code for Joy Wellness Partners. I think particularly the NAD is huge, just because, yes, it's something that I recommend for all my patients. Supplements have really come a long way. We've always known that they are helpful, and more recently, I think we've been getting the studies that are supporting that too, which is huge, which I think is great. So it's something that I talk to my patients a lot about too. And NAD is probably my favorite one. The NAD and CoQ10 are my two favorites. But yes, depending on what a given person's levels are, a given person's history is, of course, potentially adding on more as well. So I think that's great that we offer all of this. And then I just wanted to highlight again how we all are here for all patients on their fertility journey. We know it's hard. We know, again, there's so much out there. We really, our goal with Joy Wellness, myself, our goal is to really partner with individuals, both different groups as well as patients, to help them reach their fertility building goals and really make a very stressful process less stressful. So we definitely are here for you. And then I'll open it up to questions as well. Actually, I'll stop sharing the screen because I think there were a couple of questions in the chat. Okay. Oh, yes. So one of the questions, I think I'll give this to you both, and I can answer it too, but just in terms of the NAD when it's given IV, do you typically recommend a certain time frame if patients are doing IVF, for example? How long before, how soon before do you recommend that they have the NAD infusions?
I mean, again, it kind of depends on where you're coming from. You know, if you're like, yeah, everything else is on point, I got all my health, you know,
Yeah.
stacked, all my nutrients. I mean, I think there's also the varying amounts that we do. So we usually start people with 250 milligrams, just for comfort too.
Yeah.
And so you want to take that into consideration. We're going to be titrating up a little bit. If you're coming from a position of like, I have something like chronic fatigue, I have really some stuff going on, yes, we would likely want to start again earlier, as early as possible. right?
Okay, perfect.
It's not going to hinder, it's only going to give added benefit. So there's not exactly like a one size fits all, but like as soon as you know, you can kind of do that little bit of a titration up. And then it's more about a little bit of maintenance. Like, okay, if you maybe do one per week for 4 weeks, and then you can do maybe once a month after that, depending on what your needs are. Some people will see the benefits straight away from just like, oh, I have more energy because I have this chronic fatigue picture for whatever reason. And others are just like, okay, we're just fueling up. We're getting ready for this IVF. Like within, again, like 3 months, we're going to be supporting our ovulation, our egg quality, all of that. So ideally at least 3 months.
Yeah.
Perfect. Great. Yeah, we usually say if they're taking it orally that we want it on board for at least 2 months,
Yeah.
exactly the same, and then 3 months for men with the sperm.
Yeah.
And then another question was about I know you gave a couple of recommendations for prenatals, but is there a particular omega-3s product that you recommend?
I still love Nordic Naturals
Okay.
because they third-party test, it's very transparent. You can go and see the lot number and see the level. So I've used that one a lot for quite some time. It's one of my favorites.
Great. Thank you.
I think it's the Pro Omega 2000 is the one I use a lot.
Oh, perfect. Okay, good. And then this is a question that I'll talk a little bit more about. So asking about something that we offer at our clinic, which is called gentle IVF, kind of ties into acupuncture in terms of, and what you were talking about how you don't necessarily have to do everything, especially if it's going to cause you more stress. So with acupuncture, I know some people really don't like the idea of having needles. And yes, IVF does involve needles, but we never want patients to do things that are going to cause more stress. If acupuncture is something that relaxes you, absolutely. But if you're doing it because you feel like you've been told that's what's going to help, that's not necessarily ideal if it's going to cause more stress. So whatever causes less stress. And then getting to needles. So normally IVF does involve a lot of injections. It's typically 3 injections going through the IVF process. But we now are offering something called gentle IVF, where we're really breaking it down to just 1 injection every day. So it's the same medications, the same injectables of follicle stimulating hormone and luteinizing hormone, but we're able to combine it into 1 daily shot, which is great for patients. And then we're also transitioning one of the 3rd shots into an oral medication as well. So it's really helpful because, again, injections every day. I know we see bruises on patients' abdomen. So the more we can minimize and make it, again, a more involved, stressful process, less stressful is key. In terms of who's a candidate, I definitely recommend that you schedule a consult with us. We can definitely talk about who's a good candidate for something like that. But it is something new that we're offering just to really, again, help minimize the stress involved with fertility treatment. Another question is a embryo transfer question, whether or not the embryo transfers are guided by an abdominal ultrasound or a vaginal ultrasound. That's a great question. So typically it's an abdominal ultrasound. We have patients come in with a full bladder, and that helps us visualize the uterus very well and help straighten out the cervix. Sometimes we can't always see as well, or it's a little uncomfortable for patients to have that abdominal ultrasound, and so we can transition to a vaginal ultrasound guided procedure. So we do both. We offer both at the clinic. And then let me see. I think I saw another question. Let's see. Oh, yes. How does a consult typically look at Joy Wellness? So when patients make an appointment to be seen, is it like a history intake and then blood work, or how does that typically work?
Yeah. I mean, I always tell people like this initial consultation is the most important part because I want to get a full history. Like I will sometimes go way back to when you were born. What has led you to this point?
Mhm.
What was your childhood like? Medications that you've taken, anything you've been diagnosed with, what's your diet and lifestyle like? Because these are really important aspects to help me decide, okay, what kind of testing do we need to do? What have you already had done? What's recent? We don't need to repeat that. Or sometimes eclectic lab testing, like the total tox testing. If I get that idea, like you've had a lot of exposures, we want to look at that. So yeah, that's what the initial consultation. Yeah, it's a full history. I'm going to ask you about a lot of stuff.
And then another question that I think applies to both of us. One question is, do we specialize in individuals who are more advanced age, so over the age of 40? From our perspective, yes, we take care of a wide range of ages. And I would say more often we are taking care of patients in their 40s, but I'll also just put the question to you both as well.
Yeah, absolutely. I mean, it's like I said, I feel like it is becoming more common. You know, deciding a little bit later on that they want to start the fertility journey. So yeah, we see people of all ages, but yeah, I think actually lately a little bit more advanced. So yeah.
And then I do see a lot of questions about acupuncture. And so I think what we can do for that is, I know you mentioned that you have some individuals that you recommend. We have some individuals that we work with too. So maybe we can actually just send that to the participants separately. But those were all the questions. Did you have anything else that you wanted to? Actually, there might be one more. Hold on. Let's see. Oh, the last one I can answer this one. If we accept embryos from other clinics, and yes, we do. But I just wanted to thank you both again so much. It was so good to see you again, and thank you for this thorough assessment and discussion of the supplements, how we can optimize fertility from a stress perspective. Just because, again, it can be a very stressful process. We know that, and we want to work really hard to help minimize what can be a very stressful process. And having partners like you to work with and send patients to is huge. And we always love collaborating. But if you have any closing remarks, I'll definitely put it back to you guys.
We're looking forward to collaborating more, and we welcome any other questions. Our phone number is on the website, joywellnesspartners.com. So reach out to us at any time, and thank you so much.
Yeah, thank you both. All right. It was good to see everybody. Bye.